Yeah. Just
Okay,
type
got it.
Bagga, Roshandeep.
Okay, got it.
No, Rosh. हाँ.
Hi. Hello. Hi, everyone. Thank you for joining. We're just waiting for Dr. Bagga to join. Thank you so much, Sneha Singhi, for saying that. We do our best. Hi, everyone that's joining. Please give us another minute. We're waiting for Dr. Bagga to join. Mhm. So today, हम लोग आज questions लिए हैं from the audience itself. The audience has been parents, professionals, also individuals with disabilities. So if you did not get a chance to leave your question, we suggest कि आप इस comment में अपने questions drop कर सकते हो that you will have with Dr. Bagga. So everyone that's joining, apologies, we're running 2 minutes late. We're just waiting for Dr. Bagga to join. So Dr. Bagga is joining us any minute, and if you have any questions, please drop it on the chat box, and we'll take it up. Yes, I think I have accepted. Accepted? Yeah. Hello, hi, Dr. Bagga.
Hi, Sachi. Hi, everyone. I'm sorry I'm being late because I was not
No,
able to come.
no. We're also really sorry we started late. So let's begin this quick Instagram live. We have Dr. Bagga with us for the next half an hour. And आज के सेशन में we have Dr. Bagga that's answering questions. हम लोग ने एक पोस्ट लगाया था जिसमें parents, individuals with disabilities, a lot of people had dropped their questions, which we've compiled today, and we'll run it with Dr. Bagga. So, Dr. Bagga is the founder and director of Therapy for Ability in New Delhi, and he is also going to give a short introduction on in what he really does on his center, so that people who want to consult with him can get in touch with him either on his personal profile or on Therapy for Ability. Just in regards to both Therapy for Ability and India Autism Center, the information that we share today is general opinions only and should not be taken solely as therapeutic advice. Both Therapy for Ability and India Autism Center really strongly suggest कि आप एक qualified healthcare professional and occupational therapist को consult करो, assessment लो before you follow this advice. So, Dr. Bagga, we'll dive into some questions, but usse pehle I have one question which is actually really important, which had come from an individual with disability, which said ki, I want to know what is occupational therapy and how is it different from other therapies? And how can someone really benefit from occupational therapy?
Okay. In my first reel also, I have tried to describe this occupational therapy. ये बहुत बड़ा वर्ड है ऑक्यूपेशनल थेरेपी लाइक ऑक्यूपेशन की अगर मैं बात करूं तो जो भी इंसान who is devoid of his occupation because of any reason, it's not about that neurological disorder ही होगा, maybe some orthopedic problem or maybe any sort of an emotional problem, psychological problem हो गई. So if any person who is devoid of his occupation, तो एज एन ऑक्यूपेशनल थेरेपिस्ट हमारी ड्यूटी होती है कि उसको उसके ऑक्यूपेशन में लेके आया जाए. सो जब मैं ऑक्यूपेशन की बात करता हूँ, हमारे लिए बहुत इंपॉर्टेंट है समझना कि ऑक्यूपेशन एंड प्रोफेशन दो अलग चीजें होती हैं. सो 80% बंदे सोचते हैं कि अच्छा प्रोफेशन एंड ऑक्यूपेशन इज अ सेम थिंग. ऐसा नहीं है. ऑक्यूपेशन का मतलब होता है सर्टेन एज में हर एक इंसान को एक सर्टेन चीजें करनी है. अगर कोई 2 साल का बच्चा है, उसका ऑक्यूपेशन राइटिंग नहीं है, उसका ऑक्यूपेशन है प्ले. उसका सो इफ सपोज अगर 2 साल का बच्चा प्ले नहीं कर रहा, तो दैट मीन्स कि उसका ऑक्यूपेशन जो प्ले है वो नहीं कर पा रहा. सो एज एन ओटी मुझे उसके प्ले स्किल्स इंप्रूव करने हैं. अब देयर कैन बी मेनी रीजंस, मे बी एज अ फिजिकल चैलेंज, मे बी एज हैविंग अ न्यूरोलॉजिकल चैलेंज, मे बी एनी जेनेटिक डिसऑर्डर्स. तो उन सब चीजों को हमें ध्यान में रख के उसके ऑक्यूपेशन विच इज अ प्ले, उसको हमने एनहांस करना है. इसी तरीके से इफ आई एम वर्किंग विद अ चाइल्ड ऑफ अ 5 ईयर ओल्ड, तो मैं अब वहां पे उसके साथ प्ले से कम उसका राइटिंग स्किल्स एंड उसके ग्रॉस मोटर स्किल्स, देन द ऑक्यूपेशन ऑफ अ 5 ईयर ओल्ड चाइल्ड विल बी एंटायरली डिफरेंट. तो वहां पे ओटी का प्लान बिल्कुल अलग हो जाएगा. सिमिलरली 60 ईयर्स में जाएंगे हम, देन ऑब्वियसली वो उसका प्लान ओटी का अलग होगा. सो ओटी इज अ वेरी बिग टर्म डिपेंडिंग अपॉन द एज हम जिससे डील कर रहे हैं. सो बीइंग एन पीडियाट्रिक ऑक्यूपेशनल थेरेपिस्ट, so I usually deal with the kids not more than 10 to 12 years.
Okay, understood. So OT, as we understand, does not have any age bracket, and you can get an occupational therapist consultation depending on what your um, what your history has been, and there can be improvement charts based accordingly.
Absolutely.
Understood. So on that note, we actually have a question from Shweta, who has a child who's 7 year old, and she has been noticing a lot of that the child is licking non-edible things, जैसे soap या Vicks या chair या stainless steel, other eatables. उसको he'd rather lick than eat. So she is curious to know ki how can we replace or reduce this behavior, and if what is the OT consideration that you would give for this concern?
See, there are 2 3 important things, Shweta, if you're going to ask me. देखिए, mouthing दो तरीके की होती है. One where, as you have specified, said that he is licking the things. So what he is doing, basically he is exploring. तो जब हम exploration की बात करते हैं, तो we basically take it as a tactile input. अब इसमें 2 3 चीजें बहुत इंपॉर्टेंट है. इफ सपोजेटली उसकी लेट ऑफ लेट माउथिंग स्टार्ट हुई है या फिर लिकिंग स्टार्ट हुई है, तो वी नीड टू सी हाउ वाज हिज टेक्टाइल इनपुट. लाइक जब वो टच करता था, वेदर ही वाज अनईजी एट दैट टाइम. सो अ कंप्लीट टेक्टाइल प्रोफाइल अगर हम इसका करेंगे, देन वी विल बी एबल टू क्लियरली से दैट इट्स अ टेक्टाइल इशू. और सपोजेटली अगर हम उस प्रोफाइलिंग में जाते हैं और हमें लगता है कि नहीं उसके टेक्टाइल इश्यूज नहीं है, अगर मैं सर्टेन एग्जांपल्स दूं, लाइक ही अवॉइड सर्टेन टेस्ट, तो खाने में अगर उसको कोई प्रॉब्लम है एंड ही हैज अ प्रॉब्लम विद वेयरिंग कैप शूज सॉक्स, ईदर वो बहुत ज्यादा सीख करता है, लाइक सपोजिटली पहले उसको कुछ ना कुछ अपने हाथों में चाहिए ही था बिकॉज ही वॉज सीकिंग दैट टेक्टाइल, सो हो सकता है कि दैट सीकिंग फ्रॉम हैंड्स हैव टर्न्ड इनटू द माउथ। तो अब उसको हाथ में कुछ नहीं चाहिए, अब उसको मुंह में कुछ चाहिए। So if it's specifically, if you're talking about licking, that he is licking the cream, lotion, soap, I think it's more of a tactile thing. तो उसको अगर हम बहुत ज्यादा tactile exploration activities देंगे, maybe a use of a Z wipe and regular basis, on a regular basis means आपको intensively कराना पड़ेगा अगर ये बहुत ज्यादा है. Maybe after 3 hours, 4 hours for 10 minutes of a oral stimulation can really decrease his needs. So what I think, if it's specifically licking the things, it's a tactile thing. So give him lot of oral stimulations.
Mm-hmm.
Yeah.
Understood. Thank you so much for your question, Shweta. And I think Dr. Bagga ने काफी succinctly ये highlight भी किया है. For any such, is there any for these tools, these tactile tools, is there something जो आप suggest करते हैं, Dr. Bagga? Is there a specific brand or are there some specific products that you suggest for children who have this need,
See,
this sensory
the,
processing?
again, and the thing is कि whenever I try to give any oral stimulations या कोई भी sensory stimulation हम equipment use करते हैं, तो मैं हमेशा पेरेंट्स को बोलता हूँ कि 1-1.5 वीक के लिए आप इसको यूज करो एंड देन यू नीड टू सी। कई बार क्या होता है कि हमें पता नहीं लगता और हम ओवर स्टिमुलेट कर देते हैं किसी भी सेंसरी इनपुट को, उससे क्या होता है कि इश्यूज हमें बड़े हुए दिखते हैं। तो
Okay.
इसका आंसर एज ए थेरेपिस्ट हम नहीं दे सकते जब तक कि वी आर नॉट स्टिमुलेटिंग इट। हो सकता है कि वो बच्चे की नीड को सेटिस्फाई करे और कभी कभी होता है कि वो नीड को इंक्रीज कर देता है। सो फर्स्ट ऑफ ऑल लेट मी टेल यू दिस, कोई भी सेंसरी इक्विपमेंट यूज करने से पहले आप 1 या 1.5 हफ्ते का फेज लेंगे जहाँ पे इंटेंसिवली आप बच्चे की एक्टिविटी को ऑब्जर्व करेंगे, ठीक है ना। जैसे कि हम स्पेसिफिकली लिकिंग की अगर हम बात करें, आई थिंक अ प्रोडक्ट कॉल जी वाइप, वाइप्स इज बेसिकली अ शॉर्टकट ऑफ वाइब्रेटर, ठीक है ना। तो अ जी वाइप और एक आजकल इंडियन प्रोडक्ट आया जिसे हम वाइब्रेटरी पेन, वी पेन कहते हैं बाय स्पीच गियर्स, यू कैन ट्राई दैट थिंग, ओके। एंड आई थिंक कि उससे अगर आपको लगता है कि फर्क आ रहा है, इट्स परफेक्ट। नहीं तो हम डिसेंसिटाइजेशन टेक्निक्स लाइक आजकल तो विंटर्स है लेकिन सर्दियों में यू कैन यूज अ लिटिल बिट ऑफ एन आइसिंग, अ स्प्रे मिंट सॉर्ट ऑफ अ थिंग जहां पे उसको ओरल स्टिमुलेशन लॉन्ग पीरियड ऑफ टाइम तक मिलती रहे। वी कैन यूज दैट। अगेन आई वुड सजेस्ट अपने ओटिस्ट के साथ पूछ के 1 हफ्ते का पूरा स्पैन बना के, अगर आपको लगता है कि सेंसेशन रिड्यूस हो रहे हैं, परफेक्ट। अगर आपको लग रहा है कि उससे इंक्रीज हो रहे हैं, देन प्लीज कंसल्ट योर ओटी कि ये चीज तो वर्क नहीं हो रही, अब मैं नेक्स्ट क्या करूं, ठीक है।
Understood.
बट revive is a very good thing to use.
Got it. So we'll drop the name of the product in the comment for the audience to see. What is very helpful to know is कि अगर आप जैसे डॉक्टर बग्गा ने भी कहा कि when you're addressing sensory processing concerns, then just to to go to a tool and hope that it solves the issue is a bad idea. आप please consult कीजिए through an evaluation and through sensory and doing different sensory activities. These tools can actually even aggravate. So please go for a thorough evaluation. So thank you so much, Shweta, for this question. I'm taking up the question of Shrishti, whose child is 6 years old. And unka concern hai that she keeps tapping on an object with a pointed finger. How to stop this? What does this indicate? If you can please highlight something, Dr. Bagga, for this.
Okay, again, it's very difficult to say, but let me guess. मैं अपना experience I'm going to share with them. So उनको देखना है कि उनका बच्चा किस सेंस से उसमें जा रहा है. So here, यहाँ पे दो चीजें हो सकती हैं. As a parent, it's very important to understand. अगर वो टैप कर रहा है, so if he or she is tapping, so टैप करने से एक sound produce हो रहा है. So whether he is seeking that sound or not, तो ये चीज आपको कंफर्म करनी पड़ेगी एंड देन यू नीड टू सी दैट इसके साथ उसकी हमिंग है या नहीं है, लाइक ही इज कीप ऑन हमिंग द थिंग्स। और अगर उसको टैपिंग नहीं मिलता, इफ ही हैज अ पेंसिल और सर्टेन ऑब्जेक्ट, तो उसको भी वो टैप कर रहा है। सो दिस कैन इंडिकेट यू या वो तो साउंड सीक कर रहा है फर्स्ट। If there is nothing like that, he is not seeking the sound, it's only the finger tapping, he is keep on doing it. You need to see whether, see, if I'm tapping, So I'm getting a pressure on my fingers. Am I right? So in that case, Izzy has a proprioceptive need where he's seeking pressures from different part of the body also, like he's jumping on his knees, or maybe he's pushing and pulling somebody, or maybe a feature where he's pinching a lot to the parents. So
Hmm.
again, it's very difficult for me to say, but if you feel like it's more of a pinching and he's actually seeking a lot of pressure from different parts of the body, it can be a proprioceptive need. Otherwise, and if he's doing a lot of tapping where and he's humming and he's producing sound with different objects, it can be a auditory also. So
Understood.
just look around what is the thing, and you can then consult with the therapist how to do that.
Understood. So, Shrishti, आपको, like, just to conclude, like Dr. Bagga said, you have to understand if he's fulfilling either a tactical or an auditory need. And based on that, I think the therapist can help you assist in what sensory seeking behavior is he trying to fulfill. Is that correct, Dr. Bagga? Yeah.
Absolutely.
So, Dr. Bagga, I have had बहुत सारे questions about hyperactivity. And ये
Hmm.
hyperactivity, we've had someone also drop it in the comment right now. And बहुत सारे अब जब reels भी हम लोग जब collaborate भी किए थे reels में, there were a lot of parents who were asking about hyperactivity. And what I understand is कि काफी बड़ा spectrum होता है hyperactivity. So how do you, and it's extremely individualized also. So, what
Absolutely.
are your comments for parents who would like to change this behavior or are looking for advice on this?
Yes. See, it's a very confusing question for me also. But uh, with my experience, let me tell you one thing. Let,
Mm,
let me tell you one thing. That not sometimes, many a times we should take hyperactivity as a positive thing. Why? I know, अगर एक बच्चा जो सारा दिन jump करता जा रहा है and रुक नहीं रहा, तो for the parents it's quite depressing.
correct.
But somewhere a hyperactive child is a very good learner. Let me tell you this thing because I've been working with the hypoactive kids also and hyperactive kids because वो environment से इतना ज्यादा absorb कर रहे हैं चीजों को. Problem ये आती है कि he is absorbing too much of a thing. So what we should do is to first obviously we have to structure the things because जितना वो structured रहेगा जितना उसका environment non stimulating रहेगा उतनी उसकी hyperactivity कम होगी. Secondly, अगेन सेकेंड क्वेश्चन आता है जो पेरेंट्स आके पूछते हैं कि सर हमें मेडिकेशन में डालना चाहिए या नहीं डालना चाहिए हाइपर एक्टिविटी के लिए. वेरी कंफ्यूजिंग क्वेश्चन फॉर मी अगेन. तो मैं उनको कहता हूँ मैम जस्ट गिव मी 3 to 4 months फॉर द इंटेंसिव ओटी. लेट अस डू. अगर हमें 20% या 10% भी हाइपर एक्टिविटी में रिडक्शन मिलता है, इन दैट
Mhm.
केस आई वुड सजेस्ट कि हमें मेडिसिन के लिए रुकना चाहिए बिकॉज अगर 10% रिडक्शन थेरेपी से मिला है इसका मतलब हम सही ट्रैक पे चल रहे हैं. हाइपर एक्टिव टेक्स वेरी लॉन्ग टाइम टू सेटल डाउन. तो पेशेंट नीड्स टू बी द पेरेंट्स नीड्स टू बी वेरी 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 पेशेंट. और उनको लगता है कि अगर हाइपर एक्टिविटी 3 महीने में कंप्लीट कम होगी, ऐसा नहीं है. इट मे टेक years and years. बट अगर उनको लगता है कि इट्स गेटिंग डाउन, it's really getting down, and with hyperactivity reducing, the learning is getting better, then it's perfect. मगर कई बार क्या होता है कि हाइपर एक्टिविटी इज रियली आउट ऑफ कंट्रोल. हम थेरेपीज देते हैं 6 months की, इनफैक्ट वेयर वी से कि मे बी एन hour of intensive therapy at home and then in a center, उसके बाद भी अगर हमें रिजल्ट्स अच्छे नहीं दिखते हैं, then I would suggest कि the parent can go for the medication sort of a thing. But hyperactivity takes time. Do a intensive home plan. Take a intensive home plan from your therapist. Try to do the certain sensory activities every 3 to 4 hours. At least some sensory input आप उसको देते रहिए जो भी उसकी need है in fact. And then maybe down the line give 6 months to your therapist. अगर नहीं solution होता then I think that you need to consult some psychiatrist or neurologist for it. But 80% of the cases what I believe कि hyperactivity reduce definitely होती है. Secondly, structure, ABA and lot of other therapies. See, it's a framework. We cannot say कि OT ही सिर्फ role play करेगा. इसमें there are a lot of other therapies. So उनको भी अगर आप add on करेंगे उस framework में, I think many of the kids get settled down within a year or so.
Yeah.
But it will take time.
Yeah. So Aniket had a question, why do we need to reduce hyperactivity? And Aniket, I don't know if you joined the live soon. It was actually what Dr. Bagga had said is hyperactivity, is it really a positive? Why caregivers and parents have this question of hyperactivity is when it becomes not constructive in the sense of self-harming for themselves or for others, which is what we've had parents drop in their concerns for. So thank you, Dr. Bagga. आपने ये बहुत अच्छे से समझाया hyperactivity and how parents can deal with this and really look at the positives in it and see when really strict intervention is needed. Dr. Bagga, the second topic जिसमें we were flooded with questions was posture and how postural reflexes. So मैं तीन जन का combine कर देती हूँ ये. Mizna said how postural reflexes can affect a child's performances, and how can it be corrected. Usme se Neha has also said कि my son does not sit straight on a chair. Within 2-3 minutes, he'll slide and he'll lie down in a position. He also
Hmm.
hops and runs in a single direction.
Hmm.
Um,
Hmm. Hmm.
and we also had a comment on this Instagram live as well about 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 sitting and about postures. So, Dr. Baga, can you please shine some light on this?
Now, postural reflexes is it's not a new term, but it's a very complicated term. I think the person who have used this word actually knows something about the posture. So, the thing is, see, posture stability, if we talk about posture, we need to go on the milestones because somewhere what we have seen, if the child who is having a poor posture, somewhere he has crawled very less, or maybe he has done a kneeling, or maybe all the milestones which he was achieving, either he skipped any milestone or he did it pretty quick. So he didn't give the time which he used to, which he should give. Like crawling should be for at least 3 months. 3 months की तो 2.5-3 months crawling होनी चाहिए. So when we try to assess और हम parents से पूछते हैं तो parents कहते हैं sir he crawled but for only 15 days और उसके बाद वो खड़ा हो गया. So see,
Hmm.
if a child who has skipped any milestone first, or if a child who has achieved the milestones pretty quick, और उस फेज में वो नहीं अपने माइलस्टोन्स को अचीव कर पाया, लाइक उसने 3 महीने नहीं सिर्फ 15 दिन क्रॉलिंग की, नीलिंग उसने 10 days की, इन दैट केस डेफिनेटली मैनी केसेस में क्या होता है कि उनका पोस्चर अनस्टेबल होता है बिकॉज उनका रिफ्लेक्स इंटीग्रेट ही नहीं हुआ, उनका पोस्चर स्टेबिलिटी, their muscles were not ready, their muscles were actually not having enough strength. So those kids are definitely going to have a poor posture. So if the parents feel that उनका बच्चों का poor posture है, so they need to see उनके माइलस्टोन्स कैसे थे, क्या उनके माइलस्टोन्स प्रॉपर वे में गए हैं या नहीं गए, फर्स्ट. सेकेंडली सी हाइपर एक्टिविटी इटसेल्फ आपको एक जगह बैठने नहीं देती. सो इफ अ चाइल्ड इज हाइपर एक्टिव, ही इज नॉट सिटिंग एट वन प्लेस. So you know the connection between the muscles and brain. So when I'm talking about muscles, I'm talking about postural muscles. जो muscles जो मेरी body को stability provide करती है, उनमें इतना strong connection नहीं बैठता. तो इस केस में ना when we do a therapy और and we when we try to give a lot of balancing activities या फिर उनको मैं dynamic surfaces में करवाता हूँ, they are very good. They are very good. So कोई भी आके बोलेगा सर मेरे बच्चे का posture तो बहुत अच्छा है, he is doing such a high level activities. But the moment when we make them to stand at one place, they are not able to stand. So again, they are just wobbling front and back. तो that gives कि उसकी जो postural stability है, so postural stability का मेरा मतलब यहाँ पे है posture stability where you are sitting at one place for a long period of time. So that is one of the things. Now, अब इसमें आता है कि how to improve that. Obviously, if I'm talking about postural stability, I will not try to go much of the dynamic activities, balance board, balance beam, मैं इन सब activities में नहीं जाऊंगा. I would try to go for a more stable activities, like maybe bearing a weight on a kneeling position, on a half kneeling position, थोड़ी देर तक आप रुको, like the way we do in yoga. योगा postures को जैसे हम maintain रखते हैं. Secondly, any activity where the child has to stand at one place and then has to do a lot of activities. The term is bilateral integration. So bilateral integration का मतलब होता है कि you try to engage a child with both the hands together. तो हम कोई भी एक्टिविटी अगर उसको देते हैं जहाँ पे वो दोनों हैंड्स को एक साथ यूज करे, यू विल सी अ वेरी गुड postural stability, muscle strengthening, which is again very important thing. So again, postural stability हमें देखना पड़ेगा कि what is the reason. If the posture की tone is poor, then again you have to work. And if it's a hyperactivity जिसकी वजह से वो stable नहीं हो रहा, then
Hmm.
give him lot of stability activities.
Understood. So what I understand again from this is कि ये the entire field of occupational therapy, as I understand correctly, Dr. Bagga, is extremely tailored and extremely individualized, correct? But
Absolutely.
the idea of today's, and I hope what Dr. Bagga has said about these postural challenges, and that there are different layers to this. There are different there might be different reasons for these postural challenges, that these nuggets of information really start as a starting point of awareness, of encouraging parents and individuals with disability to reflect on different aspects related to posture. So if you have any more questions related to posture, please drop it in the comments, and we will have either Dr. Bagga address it in another live, because this is a really complex topic which requires more attention. Dr. Bagga, we had again a lot of questions about learning, writing, understanding, and concentration. Geetu, who has a child who's 8 years, mentioned कि these are issues that they face. And I'm somehow, मुझे ये question आ रहा है कि is posture and concentration sort of interlinked, or is that a wrong
Absolutely.
understanding?
Absolutely, absolutely. I think now everyone should be able to understand that things. Stable posture होगा तो attention better होगा ही होगा. So
Yes.
that is one of the things. Absolutely, you're right, Sakhi.
So, and Dr. Bagga, ये executive functions के लिए, how can an OTS like assess and address these difficulties and work towards it? Because we've had several questions, and कैसे हम organize करें. I have ADHD, I have troubles in organizing, I have trouble in sustaining attention, in planning. So how can occupational therapy come and help in this realm?
Okay. See, there are two, three things which we again need to see. If a child or the person has a coordination problems, and if he's not able to coordinate the body, and if he's not able to memorize the things for that, in that case, I would suggest that lot of high functioning therapy, lot of high functional occupational therapy activities may be needed, where we need to integrate the visual motor aspects, the auditory motor aspects, and see if he get better in the executive functioning or not first. But again, in here, I think the role of the educators and the role of the other therapist is also very important. Teachers का role बहुत important आता है.
Mhm.
Like if a child is not able to memorize the things and वो बार बार चीजें भूल रहे हैं, तो maybe a visual prompting can really work with them. And maybe अगर हम एक चीज को बार बार repeat करवाते हैं, so that actually becomes a muscle memory for them, and then it becomes the journey becomes very easy for them, because it's a disorder. ये struggle रहेगा उनके साथ, है ना? So lot of practice, lot of coordination exercises, and the therapist needs to go hand on with the educators and the teachers, and any caregiver who is taking care of that specific child or the adult, then can work. Because यहाँ पे ना, as a therapist, मुझे exactly issue पता होना चाहिए कि वो struggle आ क्या रहा है. तो वो
Understood.
मुझे सबसे क्लियर एक केयर गिवर ही बता सकता है, या टीचर्स या एजुकेटर्स बताते हैं, एंड देन प्लान करना बहुत इजी हो जाता है. सो मे बी एन ऑब्स्टिकल कोर्सेज, कोऑर्डिनेशन एक्सरसाइजेस, हायर सेंसी प्रोसेसिंग एक्टिविटीज विल कैन रियली इम्प्रूव. बट दिस रिक्वायर्स लॉट ऑफ प्रैक्टिस, शेड्यूलिंग, रिपीटिशंस, जो घर पे ही हो सकती है या स्कूल में हो सकती है.
Understood. So, दूसरे सब जो questions आए थे Dr. Bagga, I think we need to do more educational videos regarding that, were exercises to improve fine motor skills. So we are planning to do a lot more reels with Dr. Bagga. So please stay tuned to both the pages, Therapy for Ability, Dr. Bagga's page, as well as India Autism Center, to know, to get more ideas on the exercises that you can help your children with and yourself with posture, with improving handwriting, with helping, with a plan to help with sustained attention, etc. So this actually brings us to the end of our Instagram live, and thank you everyone for joining. Thank you so much, Dr. Bagga, for your time. Especially on a Sunday. Really, really grateful to you. In today's discussion, Dr. Bagga discussed everything from postural reflexes to sensory integration to how early intervention also turns out to be a key, from fine motor skill development and lots more. And we hope to have this Instagram live with you, Dr. Bagga, as often as possible, because I think parents need this direction, and also individuals with disability need this awareness and direction, and how an OTS can help them. So thank you again, Dr. Bagga, and we hope, and please, everyone in the audience, please stay tuned to our reels that is coming up very soon with Dr. Bagga.
Thank you, Sakhi and India Autism Center for giving me this platform also. And I hope कि कुछ तो answers parents को मिले होंगे, कुछ confuse हो गए होंगे, कुछ maybe they might have been cleared their doubts. But definitely we are going to make more and more videos, relevant videos, which should actually help the parents. And thank you
Yes,
very much.
we look forward to that. Thank you so much, Dr. Bagga. Have a good
Thank you.
Sunday. Thank you.
Thank
Bye.
you.
Thanks,
Bye.
Dr. I've closed. So, to get saved. You stopped it?